So great. Hey everyone. Good evening. Welcome to this session. India as a medical tourism destination for Africa. And I have with me my very old friend, Dr. Wale from Nigeria. Hi, Dr. Wale. Thank you very much for, accepting to give a small talk on this particular subject and,
Everybody.
enlightening.
It's 4:30 around 5 p.m. in Nigeria. Good afternoon, everybody. How are you?
So,
Good afternoon.
yeah. So I'm audible, Dr. Nitin Babu. Am I audible?
Yes, you're audible.
And Dr. Wale as well.
Yes, we are
Yeah,
very
you're
audible.
both.
Very, very audible.
Okay, excellent. Okay, so let's begin. Welcome everyone. So Dr. Wale, okay, now you have been in India, you have done a lot of medical tourism business. So you tell us, like, what do you think after COVID, especially? How has there been a change? If there has been a change, what exactly it is in
Thank
medical
you,
tourism?
Panel. Thank you, Panel. I think prior to COVID, medical tourism was a big thing for globally, especially from Africa to India. But because of COVID, a lot of countries in Africa and even some part of Asia too that are not India have actually developed local capacity. Because while during COVID we had no choice, we had to look for a way to take care of our health needs. So COVID was a blessing in disguise, actually, to especially Nigeria, my country. So we're able to develop some new specialist hospital. Now we have developed 4 world-class cancer centers in Nigeria. The federal government has invested over $200 million in oncology care in Nigeria in the last 3 years. So government of countries, especially in Africa, have realized that they have to build local capacity. But I think saying that I still believe there's still going to be a lot of collaboration between India and Africa in medical tourism. But the strategy has to change. The strategy whereby you are on Facebook or you're on social media trying to attract patients from Africa, you have to develop a different model. You have to have a sustainable model, have strong partners in Africa. I believe going forward, some of these medical tourism companies have to come into Nigeria or African countries and develop physical partners in terms of hospital partners, Ministry of Health partners, and for specific cases, not just all cases. And a model I think will actually work again is whereby you develop local capacity. I'm sure some Indian hospitals have tried the hub and spoke model. You develop a spoke in Nigeria, maybe at least a secondary care center, not even primary, a secondary care center that can even be revenue, that can generate revenue for the hospitals in India. And I believe some medical tourism companies can actually partner and invest in some existing hospitals in Nigeria that are looking at investment. Based on that, they can link up with their partners in India and be able to refer their own patients that cannot be treated locally to India. So I will appreciate if questions can come from the audience to what areas you want me to actually address in our sector and in our country.
So, what are the brands that are that operate business wise in Nigeria? I'm talking about Nigeria first, and then I'll go to the other countries. But in Nigeria, what are the big Indian brands?
The big Indian brand is one of the big Indian brands. Apparently, not in India. They don't have. It's called the Mikio Group. Mikio Group has the only PET scan in the whole of West Africa. They pioneered world-class diagnosis center about 15 years ago. They established one of the first centers that with MRI, CT scan, and they had a chain of diagnosis centers. So now they've expanded by setting up the first PET scan in Nigeria. So I think the future is collaboration, investing, partnering in the local community, in local African countries. because African governments are open to partnerships. They are looking at investments, and investment does not actually have to be in terms of financial. It can be in terms of equipment. It can be in skills transfer and all that kind of. We are looking at all that type of partnerships.
Dr. Nitin, you had a question. I just heard you come in.
Thank you for this opportunity, Jen and Adiwale. I like to ask the question that were all the physicians in Nigeria or South African continent, or they are well trained to have oncology or knee replacement for surgeries to take of the quality and standards which we are offering?
Okay, so the way fantastic, Dr. Nitin, that's a very good question. The way the world, it's a global village. The way Indian doctors left for training in the US, in the UK, in Australia, in Canada, a lot of Nigerian physicians left too for this training. So a lot of Nigerians have developed skill and they are back at home. They are the ones operating. These are big time doctors in the UK, in Oxford Street. They are top oncologists in the UK. So a lot of them are back in Nigeria and treating our patients.
Okay, thank you for answering that question. And I like to ask that what is the ratio of doctors for a patient in Nigeria?
That's a very interesting question. And I think by the statistics of WHO, it's about 1 to 1,000 patients.
Okay.
The truth is that because of the economic situation, a lot of our doctors are migrating to the UK and to the US and even to South Africa. So we have more than 30,000 doctors out of Nigeria practicing in the Western world.
Okay.
That's what's happening here also.
Yeah.
Yep.
So compared to the population of India has a population of about just short of 2 billion. Nigeria has a population of about 250 million. So
Dr. Alvi, I have one question. This is Dr. Mukherjee from Kolkata. Can you tell me that?
Dr. Mukherjee, how are you?
Hi, Dr. Mukherjee, how are you?
Fine. Hi, Paniel. How are you?
I'm fine.
After a long gap, we have met.
Yes.
Yesterday, I have
I'm
seen
good,
your
sir.
link, so I thought that anyway, I should join and I can see you because I am following you in your social media every day. And it was a fantastic event that you encourage the South Africa tourism. I am keenly interested on that and I'm trying to work it for the eastern part of the country. So I just want to know that whether this South African patient can prefer the eastern part or not.
So, Dr. Wale, he's asking you if South African patients will prefer East India, like Kolkata and that side.
Yes, Kolkata or this part.
Dr. Wale, can you hear me?
No, I think
he has some technical glitch.
Tech problem. Yes.
Yeah.
Is he there? Dr. Wale, can you hear me?
Hello?
Yes, can you hear me?
Yeah, I can hear you. I can hear you.
Yeah, so Mr. Mukherjee was asking if South African patients from South Africa would be open to come to East India, that is Kolkata, West Bengal.
Okay, so let me give you a description of Africa. Africa is a large country of more than 1 billion people. Africa is divided into South Africa, North Africa, East Africa, and West Africa. Nigeria is the largest country in Africa with a population of 250 million, a quarter of almost Africa. South Africa has a developed health infrastructure. Unlike Nigeria that has an hybrid infrastructure, we're just developing our infrastructure. In the last 10 years, there's been a lot of improvement in our health infrastructure. So I believe that South Africa should not be the target. The target for medical tourism should be East Africa, where there's less capacity. Apart from countries like Kenya, Ethiopia have average capacity in healthcare infrastructure. So I believe the smaller African countries should be the target for medical tourism.
No, my question is that
Nigeria,
whether they
advanced cancer care may be needed in India, liver transplants will be needed in India, advanced high treatments will be needed in treatment will be with the yeah.
Okay. Okay.
So is your question answered?
No, my question is, panel, that whether this maybe from Kenya, maybe from any part of the South Africa, whether they prefer to come to Kolkata or not. That is the main question.
Oh no, definitely. Patients are open. I've been to Kolkata. Kolkata is a beautiful place. Patients are open to any part of India that has good infrastructure and
Yes.
direct network in terms of travel network. Most patients are open to traveling to any part of India.
Oh, okay.
I think Kolkata has to market itself as a big brand.
Yes, it's a big market and healthcare is a big opportunity there.
Yes, I know you have very few strong hospitals there. The big chains are not.
Yes, sir. Yes, sir.
The health hub for is Chennai.
Yeah, because most of the people are interested for the Chennai and South India because this is the hub of the healthcare. So that's why my question is that whether you prefer to come to Kolkata or not. That is the main question.
So the interesting thing is that Kolkata has to actually position itself in terms of affordability.
Yes.
In terms of hospitality, in terms of the hotel part of the healthcare too, because most of the patients that come to India, they will have to have a relative coming with them. So they have to create an experience for those patients and the relative.
Oh, okay. Got it. Yes, panel. This is my side. That's from my side.
Okay. Great. I think if you look at Kolkata, yeah, even I've been there. And in terms of hospitality, in terms of affordability, I think they are good, on par. In fact, better than the other places in the country, I could say.
Yes.
But I don't know about the other big brands. If the other big brands operate there, the Indian big brands.
So my advice is that Kolkata hospital, group of hospitals, medical tourism, they have to actually position themselves. Organize medical tourism fairs in places like Africa.
Yes. So we prefer the South African patient. Yes.
So why the preference for South African patients?
No, because the affordability of the hotels are very good here, and the expertise of the doctors are also very good in Kolkata. Maybe it is in a small brand or maybe it is in a big brand. That's a different issue. But the hospitality and the hospitals and all those things are very much lucrative and very much affordable for the South African patient. Especially for the knee replacement, whatever you said, especially for the knee replacement, especially for the cardiovascular surgery, especially for the neurosurgery, everything.
Because Kolkata is not seen as a medical tourism destination in India. The most popular area for medical tourism is Chennai, Bangalore, New Delhi, Mumbai.
Yes, sir.
So Kolkata has to set itself as a brand.
Yes, Paniel. Yes, you continue. This is from my side.
Okay, great. Thank you, Dr. Mukherjee. So, Dr. Wale, as in a nutshell, can you tell us the current scenario? Like, if you take Africa as a whole, the current scenario of patients moving out to India, one, to other countries also. How is the situation there?
The truth is that, patients are segmented. We have the middle class, the upper middle class. Those are the people that can afford medical tourism. The ones below the middle class have to stay in Nigeria for their treatment. So the middle class, a lot of them come to India, but the upper middle and the rich, they all go to Europe, they all go to UK and the US for treatment. Dubai is becoming a center of attraction for medical tourism in Nigeria because it's just one flight. It's just 6 hours flight to Dubai.
Okay.
So India has to offer far more. The game has actually changed because the patients are aware themselves. They are cost conscious. They are actually they profile and credential the kind of doctors that will treat them too. There's a lot of information in the space now. So gone are the days that a small, not well treated, not a consultant that doesn't have a lot of experience can take to do some of these surgeries. Because there's a lot of fact finding, they try to investigate to what the physician or the consultant or the surgeon has done. So the game is changing, you understand? People are careful now. So a surgeon that's maybe a kidney transplant surgeon or a knee replacement surgeon has to be one of the best to attract good patients.
Okay. And what has been the feedback of patients who have come from India? They're happy?
But generally, patients most of them have been very happy because one, a lot of them have had follow-ups. A lot of hospitals they developed relationships here for follow-up because that's one of the challenges initially when medical tourism started. These patients are chronic patients. You treat them in India, there is need for follow-up. That's what a mistake some of the Indian hospitals had earlier developed. There was no mechanism for follow-up. But now they have collaboration with hospitals and some local doctors for follow-up. So I think the outcome has been very good.
Okay.
And I think some of the Indian hospitals are very smart. They've come into
Yeah, I think we lost him again.
Yeah.
That has partnership with hospitals, about 2 hospitals in India. They actually run the biggest transplant program in Nigeria now, about 15 to 20 transplant cases every month in Nigeria now. So it has reduced the numbers of transplant cases that have to come to India.
Who are they?
A Nigerian company, a local Nigerian company.
Okay.
Yes, it's working with 2 companies. I think one of them is from Hyderabad and the other is from Delhi. So there's this team of transplant surgeons that come to Nigeria every month. They are working with these nephrologists and urologists in Nigeria. They carry out about 15 to 20 transplants every month in Nigeria. It's been a successful project. And I think in terms of finance, it's been worthwhile. The return on investment has been very exciting.
Okay, so which are the major hospitals which are coming to Nigeria? The patients from Nigeria, which are they preferring to come to India?
Interestingly, it's the big brands. The Apollo Hospital, the Medanta Hospital, the big brands, the popular big brands in India.
Okay, what are the costs they are occurring when they come to these transplantations?
I think the average transplant cases is between 10 and 15,000 US dollars, I think so, for kidney transplant. And interestingly, it's almost the same cost in Nigeria to have the same transplant.
Okay, but the quality of the services are same or differing? It is differing from the.
Okay, let me give you a scenario. Earlier on, 3, 4, 5 years ago, most of the patients used to come to India for transplant. In the last 3 years, it has reduced. And the patients that have been locally, they've had their transplant locally, they are surviving. We have 5 years, 5, 6 years post-transplant patients done in Nigeria, and they are living well, they are doing well. So the success rate has been very good. As any surgery, there's always complication. Maybe a success rate of about 85, 90%, which I think is very good.
Okay.
So there's one question yes, go on, Dr. Nitin, finish here.
Okay, no, you continue. Later on, I will just ask.
Okay. So there was one question from one of those who had registered who said they're planning a startup on medical tourism. How should they start? I mean, what all should they do? They just wanted a few tips or a little advice from you.
I think my first advice is that they should do their research very well, understand the market. They should actually come down to if they are targeting some African countries, they should come down, visit the African countries, look at the players, come in to do internal marketing, look in the local markets, not just stay in India, open a medical tourism company and try to work online on Facebook and or social media. They have to test the pulse of the market and come to the market. If they are targeting maybe Nigeria, Ghana, Kenya, they can do a test case, one or two of the countries, visit there, meet people. The first thing might be even to set up a camp with an existing hospital in India. They can do a free screening camp, depending on the specialty they want to start with. They have to hit the ground. They can't just sit down in India and try to get their patients. Social media is good, but you have to actually feel the pulse, come down to and understand, because there's still a lot of opportunities.
Okay. And are doctors and other, other medical staff willing or open to come to India for training? Does it go on?
So many of our physicians, nurses, paramedical workers are very interested in training in India. That's another area that a smart medical tourism company can use to penetrate the country, to organize training programs, and from there you have loyalty to some of these consultants and doctors that come to India, and they can refer patients to you.
Dr. Wale, I have one question, plus I have one doubt from your side for you, because I am also involved in some nursing training, paramedical training, because I am involved in one university of Kolkata. So if we get the opportunity to train your paramedical staff, especially those who are dealing with pathology, those who are dealing with radiology, your physiotherapy, your critical care, we have the separate module to teach those students. So we can accommodate them here also for a big exposure. So can we get this type of opportunity from your side?
Yes, I can actually facilitate this. There are some private nursing colleges opening up. You can actually collaborate with the and this could be a very good opportunity.
Okay, then even I have a suggestion, and I have an opinion on this. We will give a better option.
Yeah, go ahead, please.
See, the thing is, we can send for training for you in any other countries, like developed countries like US, UK, or whichever countries you doctors want to practice, or you come to India or you want to practice or train up, enhance your skill. We are ready to provide you all the support and facilities and the infrastructure and all the things which you require. We are ready to provide you all the things. So we can get the patients from your sides.
Dr. Nathan, you asked about doctors or the patients?
See, we are ready to spend on doctors, on training them and enhance their skills and everything. So in return, we are expecting that they should send us some patients.
Okay. So you are gonna train them in their countries?
No, we are no any other whichever country they are preferring. We are ready to send. Any example, like let me take US, UK, any other countries. We are ready to spend on the doctors.
Okay.
And in return, we are expecting some patients from those doctors.
Okay. So, Dr. Wale, Dr.
Yes, I want to respond to Nitin. So when you say you are interested in training doctors in the UK and the US, specifically, are you requesting this as a university in India or as a medical tourism company?
Sorry, I didn't get you.
As an individual, as an organization? Yes, or why are you requesting this as an, yeah. You are requesting that you mentioned that you're ready to train some of our doctors, nurses in the US, not even in India or UK, anywhere they want to trade abroad, right?
Yeah, that's right. See,
right?
I'm
Just confirm that you're interested. It's not just in India. You can trade them abroad, not just India.
I'm trying to say whichever country they want to go and train up and enhance their skill, or they want to do FRCS from UK, fellowship of Royal College of Surgery. They want to do it from UK, and we are ready to sponsor them, whatever the cost it might occur. In return, we are expecting.
Because listen,
in return, we are
okay,
expecting
go
some
ahead.
patients from your sides.
So let me just respond to you. This model, it has to be a long-term model. You don't expect to train somebody, make maybe FRS, fellow of the Royal College of Surgeons. For you to do a fellow of the Royal College of Surgeons, you have to do your board exams in the UK. So if you have passed your board exams, you actually don't need a sponsorship. You see, so the old model is it has to be a corporate approach. If you are partnering with maybe a nursing college or an hospital, they have loads of patients, some of them can pay. So you can be specific about collaborating with hospitals in India, maybe nursing schools, maybe paramedical schools in India that can actually train a lot of people, not just individuals. Because if you are looking at individual surgeons to be trained and expecting to send patients to you, I don't think the model will work if you are specific. But if you are looking at a group, partner with maybe a nursing college, you can train some of their nurses, maybe about 10, 20 of their nurses come to India, have postgraduate training, have specialist training, maybe in ICU care, maybe in oncology care, That's the kind of model, yes, that's the kind of model I think may work. Because if you want to find somebody to go to UK, most of these guys, once they pass their PLAB or USMLE, they just leave. For a medical professional, all you need to do is pass your qualifying exam and you can just travel.
Yeah, but the expenses which we are going to take on.
They can pay for tickets, and it's just to pay for the tickets and they pay for exam fees. It's not a lot of money. Because if a doctor has made up his mind that he wants to leave the country, because if some of them have savings, they will just buy their ticket and pay for their part 1 or part 2, or do their USMLE or their PLAB.
Okay, yeah, okay, I got the thing.
So the approach should be that, okay, I'm looking at corporate institutional partnership. I'm ready to train nurses from. So what we're going to be looking at is you can approach a state government. Nigeria has 36 states. Okay, I can train 30, 40 nurses. You have already discussed with nursing college in India where these guys can come. You can facilitate that, or the logistics, and most of the training is almost free. So those state government can send you patients because the government they can afford to send patients abroad.
Okay.
What Dr. Nitin, what we can also do, maybe at a later time, you can have a separate session with Dr. Wale.
Yeah.
You can discuss your business with him, right? Dr. Wale, would you be open for that?
No, I'm open. No, I'm open. No problem. We are very open.
Okay, thank you, Jen. It's a great opportunity.
Yeah, great. Yeah. Okay, so Dr. Wale, I also work with a woman care group called Sagar Chandrama Hospital in Bangalore. So I just want to understand the current scenario of the obs-gyn specialty in
Just
Nigeria or Africa.
Can I just pick a call? Just 1 minute.
Yeah,
Let me
go
pick
ahead.
that call. So then,
Dr. Soman, sorry, I unmuted you. There was some disturbance coming from that side, so I muted you.
We have to close the conference call. You can't just tell us in the middle of it. No, it's not done. Where's the money? It's in Nigeria, sorry. It's 45,000. We're something like 55,000.
Hi, Koena, I see you're also there. You have any questions?
Yeah, please, you can go ahead.
Yeah, so what I was saying is I wanted to understand the scenario of the women care the obstetrics and gynecology specialty in Africa? What is the current scenario? And fertility, keeping in mind fertility also.
I think fertility is a growing area. Is a growing area in Nigeria, especially. There's a lot of IVF clinics springing up. In the last 20 years, initially there were about 6 or 7 major players. The Bridge Clinic, the Nordica facility, and we are very familiar with them. But now there are younger consultant gynaes and ops doctors setting up their IVF clinics. So there are very few big corporate players.
You're talking as Africa as a whole. I mean, like the affordable.
You said 10,000.
Yeah, go ahead, please.
Yeah, so you're talking about Africa, the current entire, all the countries, right, as a whole.
No. Nigeria. But South Africa has a developed IVF infrastructure. It's more developed.
Okay.
Ghana, yeah, some of the African countries, but I think there's still a lot of scope. There's still opportunity for corporate strong players to come in.
Okay. What was I saying? So, thinking of medical tourism in terms of fertility is not a good idea, right?
Because for example, for fertility care, it's a long-term care. If you are going to, yes, you have to be in India minimum of 2 to 3 or 4 months. Am I right? Or even 9 months. How long do you have to be in India if you are?
Come again?
How long would the patient, the woman and the husband, how long would they have to be in India for IVF treatment if you want to have a baby?
Yeah, it's a couple of months actually, because it's a long process. Yes.
Yeah, a long process. So the old model should be that the big IVF clinics in India should look at partnering with local ones here, and they can make a lot of. It's going to be a big opportunity because you need to have follow-up of the patient and all that.
Are there any Indian brands or any other brands other than African?
No Indian brand. But I tell you, there's still a lot of opportunity. There's need for corporate IVF centers to come into Nigeria, the big players.
Okay. Because if you, I don't know if you see in India now, before there never used to be any IVF boards and holdings. Now they're there everywhere.
They are sprung up in Nigeria, but we have less than 20, 30 players, which is still a small fraction compared to what we have in the country.
And in Nigeria, is the capital the only place, or there are other places also which we can look at?
Nigeria has more than 10 cities that are very developed.
Okay.
A good example, like the way India is, they have the major cities in India are Hyderabad, Delhi, Mumbai, Chennai, Bangalore. Those are the main cities in India, right? And Kolkata too. Yes, actually, yeah. So in Nigeria, we have Lagos, we have Abuja. Lagos is the commercial capital. Abuja is the official capital. So we have cities that are very viable and vibrant too, like Port Harcourt. We have Kano, we have Kaduna, we have Jos, we have Enugu, we have Imo. And they have commercial viable states that people can really do well there.
Okay. How about online training? Online training opportunities are programs conducted there? Like people from India train online?
For the medical field, there is, in terms of managerial training, is different from technical training. Technical training, most of them has to be hands-on. In terms of if you want to do leadership training and all that, there are a lot of human resource too locally. There are a lot of business schools that are specific to health. A lot of people have come from the US, from the UK, from the diaspora that have been hospital managers in top hospital in the US. And they're organizing training there too. There's an MBA in healthcare in Nigeria already.
Oh, okay. That by a Nigerian university or something?
Sorry?
Is it by the Nigerian government?
No. For what? Yeah, I'm talking 15, yeah. What the mass on we tete jomo an conference e me wa no ba sorry na. Please go ahead. Sorry, yeah.
Yeah, no problem. It's work time for you there, so I understand.
Yeah, it's all time for me.
Yeah. So this course you're talking about, MBA Hospital Management, is done by the Nigerian university. Something in Nigeria.
Like the business school, the top business school in Nigeria. It's called the Lagos Business School.
Okay.
Yes.
We have one person, Koina, who wanted to ask a question. Koina, do you want to ask a question now?
Yeah, if possible, obviously.
Yes, sure. Koina, go ahead.
Hi, doctor. I have one question, sir. Like, I have been worked for few months in Manipal hospitals. I guess you heard about that hospitals. Like most of the Nigerian patients, like a family hub, you can say for that. So some of my patient friends, they wanted to adopt a child rather than going for IVF and any other things. Is that true, sir?
Can you repeat your question very well? It's not clear.
Yeah, it was not clear, Koina. Repeat it again.
Okay. Like some of my Nigerian friends, I spoke with them. Like they are not able to adopt normally, but they went for a adoption. Like they didn't conceive normally. They went for adoption.
Okay.
Yeah. Is that true, sir? They don't believe in that IVF procedure at all.
So she's saying some of her friends who are from Nigeria do not believe in IVF and they went in for adoption. Am I right, Koina?
Yes,
there's a lot of adoption. The process for adoption in Nigeria is much easier than in other countries. So some people are going ahead with adoption as a way of having a child. But it's a lot of people are actually involved in IVF too. A lot of people are doing IVF to have their kids.
Is there any cultural or religious challenge when it comes to IVF in Nigeria?
It is no.
Nothing like that. Okay.
Even older ladies that are 50 in their early 50s want to have children by IVF in Nigeria.
Okay. So what other Koina, is it okay? I mean, like, did you get your answer or you want to ask again?
Yeah, I wanna ask again.
Yeah, go ahead.
So why we are not promoting IVF there?
They are promoting IVF. IVF is being promoted big time, big time.
But still, people are not that much sure for the IVF. What is the main problem you felt, sir?
There are IVF centers that have delivered more than 20,000 babies.
Okay.
So probably what you heard, Koina, is a myth, maybe. So IVF is very much prevalent in Nigeria, and people are open to it. That's what Dr. Wale is saying.
Yeah.
Maybe it can happen that she is some particular place. They might have some myths and all.
Maybe. You can probably check with them again.
Yes, check with them, please.
So, Dr. Wale, okay, so we'll wrap up the session in some time. If anybody has any more questions, they can. You're welcome to ask. So, what do you think are the specialities that we can look up? So, say I'm a medical tourism, or say I'm a large hospital. I want to enter the African market. What are the specialities I should look at to make it big as a business?
I think the traditional specialty there's still a lot of opportunity. We have less than 5 to 10 LINAC machines for 250 million people. So for oncology care, there's still a lot of opportunity in Nigeria. Liver transplant, there's no center doing liver transplant in Nigeria.
Okay.
Surgeries like ankle replacements, hip replacement are still far cheaper in India.
What is it? Come again?
Ankle replacement.
Ankle replacement. Okay.
Yes. Ankle replacement, hip replacements.
Hip replacement. Okay.
Yeah. things like knee replacements are very possible in Nigeria. So a lot of Nigerians are doing a lot of knee replacement. Spine surgery, there's a lot of opportunity in spine surgery. We have very few spine surgeons in Nigeria.
Okay.
Advanced ENT treatment, yes. There's a lot of opportunity in that space.
Okay.
Cardiac, we still have, in terms of pacemaker placements, we have few centers that can do that, but I think there's still a lot of opportunity in cardiac treatment.
Okay.
A lot of Nigerians are hypertensive and diabetic too. So a lot of them they will need to do a re-evaluation, and if there's possible medical intervention.
Okay. So what is your plan now? So as we come to the end, I just want to ask you, Dr. Wale, what is your plan? Earlier, you used to visit India for a lot of things.
So, Panel, very good question. My plan is we are setting up a private nursing college in Nigeria.
Okay.
For about, maybe it's a big college with 100-bed hospital. That's one of the projects we are doing at the moment, and we are open to partnership with Indian hospitals, Indian nursing college. Okay. So we are looking at the future. The future is actually to develop local capacity in our country. The government of Nigeria, the present government of Nigeria is supporting that, and they are looking at partners that will support that initiative too. Because for us, we need to actually create employment for our people too.
Okay.
We have to train our own staff, we have to develop skills to here.
Okay.
So we are open to collaboration. India, where India was about 15 years ago, or at least we have progressed in the last 3-4 years. Okay. So we believe we will get there. And with collaboration with strong partners in India, we'll be able to achieve this faster than more faster than what we think of.
Okay, great. So thank you, Dr. Wale. And if any of you have any questions, you can tell them. You can ask right now, or you can send me a message if you want me to connect you to Dr. Wale separately for any of your doubts. So Dr. Wale, next time you're in India, let's catch up. And if somebody
I should be in India very soon. We need to catch up. It's very important. We can discuss other areas of collaboration, and we can see how it goes.
Yes. Great. So thank you, everyone. I think we'll end the session now. It was amazing to learn. We'll have a lot of other sessions, detailed sessions, general sessions, a lot of things. So thank you, everyone, for joining. Thank you, Dr. Wale, for your time.
Thank you. Thank you, panel. Thank you. Thank you, panel.
Thank you, Wale.
Oh, yeah.
Thank you, everyone.
Yeah,
thank you. So, okay. Bye-bye. Bye-bye.
Jen.
Yes, Dr. Nitin. Yeah.
Can we have a session?
Yeah, sure. We can. I'll separately talk to Dr. Wale when he's free, and maybe we'll catch up a little late so that it's evening for him or something like that.
Yeah, definitely. Yeah, even I thought that he was getting continuous calls.
Yeah. So when he's on our time, maybe we'll work on a midnight or something like that sometime.
Yeah, definitely we can go.
Yeah. Okay, great. So Dr. Wale, we'll talk separately. We'll fix up a meeting with Dr. Nitin so we can see how we can take it forward.
Okay. Thank you, everyone.
Okay. Thank you, Koina.
Yeah, bye.
Dr. Wale, thank you very much. Bye-bye.
Yeah, bye.